Now, if you're younger and you have some knee issues and you want to get your range of motion back, maybe it's back of the knee pain, you can certainly do this in a tall kneeling position as well, but you have to be comfortable kneeling. Same concept, sit my butt towards my heels, and this gets a nice opening in that knee joint there.
That's right. That is more aggressive again. You're going to do that if it feels good, and you're probably younger and pretty mobile.
This feels pretty good for me.
See, there you go, and he's younger and mobile. All right, the third technique is actually created by Brian Mulligan. He's a therapist. He's been around for decades, and this is a nice technique. If it works, it's very simple. And what we're going to do is if your knee particularly does not flex all the way, we want to have good range of motion. That can easily be the cause of pain. Once you free it up, then things get better. So if your knee is tight here, or here, but particularly in flexion, this is a good technique. So the whole concept is the knee does not want to flex further than this, but if you rotate one way or the other, the tibia, which I'm showing here, that can be enough to break things free, so to speak, and get more range of motion without pain or actually feeling good. So I'll show you how you can do that on yourself because it's a little harder than this. Okay, this is the knee in question. Now you need a chair that has a firm seat pan, okay? Not a soft, cushy one. That will not work so well. And then I'm gonna go like this to that point where it's a little painful. And we wanna see if we can get to that normal range of motion. Okay, so what I'm gonna do is actually grab below the knee and we're gonna get a hold of that tibia. Now we got a lot of soft tissue that kind of moves, so it's not as easy as it was with Sam. So I'm gonna grab in tight, hold it there, and then I'm gonna first assess the range of motion, say, oh, it hurts there. If I rotate things to the right, I'm actually gonna turn my foot to the right, rotate, go again, see if you get more range of motion without pain. Let's say, that doesn't seem to work so good. Then I'm gonna turn my foot in, grab and rotate that tibia in. We get a little rotation, turn the foot, and then again. Now, what'll happen oftentimes is one way it won't help, the other way it does, and you're gonna work the way that feels better, less pain, more range of motion is a green light to do it, just 5 to 10 times. Probably 10 would not be the one I'd go to right away, just up to 5 repetitions like I'm doing here. Let it go, walk around on it. If it feels better then, as well as while you're doing it, green light, do that 3 or 4 times a day. Again, assess which way feels better, and only do the way that feels better. And after you do this, you'll find that it loosens up in all phases and will have a good results.